Peyronies disease is a disorder where one develops scarring on the internal portion of the erection, which can lead to abnormal erectile curvature. And that can result in curvature that makes it uncomfortable for the patient and their partner during intercourse, might make the erection unstable, and it actually can sometimes impair upon erectile function as a whole. Nobody really knows the causes behind Peyronies. There's lots of theories about it. The best theory I've heard with regards to it is that there's some sort of microscopic injury that in most men would not necessarily cause a problem, but in men with Peyronies they get this overzealous response, and they get some scar tissue that gets deposited, and then that tissue is not as flexible and pliable. And so normally what happens is as an erection occurs, the tissues that surround the erectile chambers has some degree of stretch and then becomes taut. These areas that are scarred don't, and so it forms a sort of hinge that things bend around. It depends on the situation. Treatment for Peyronies may involve doing nothing at all. Some patients with minor degrees of curvature that have good sexual function, we don't necessarily have to do a whole lot to them, if anything. Some patients, depending on their curvature, may require major surgery. We've got procedures where we can sort of match the scarring on the opposite side to straighten things out. We've got procedures where we can cut out the scar and replace it with a graft. And then the most exciting thing I think we've seen with regards to Peyronies treatment in the past 10 years has been the introduction of Xiaflex, which is a medication called a collagenase. And what we do is we actually inject that into the scar, and over the course of a couple of weeks it breaks down those scar tissue fibers, and eventually through manual manipulation the patient will eventually be able to straighten things out significantly. Well, I think anybody that's got abnormal curvature that's bothersome to them should seek an appointment with a urologist. There are different phases to Peyronies. We can't always do much early on with regards to it. There's sort of an active phase where that sort of curvature is developing, and then we've got the chronic phase where it's just there and it's stable and it's bothersome. We tend not to do much during the active phase because we don't know where things are going to eventually settle out. We don't want to correct somebody only to have the process continue to be ongoing and then they end up still with some more curvature. We want everything to be stable for a good 6 months, and then we would treat it at that point.